Address President Cyril Ramaphosa signalled that government is forging ahead with the National Health Insurance Scheme, but the Universal Healthcare Access Coalition says the NHI will not work. The coalition has prepared a proposal which it says is a viable solution for the South Africa's health crisis. Let's speak now to Professor Alex van den Heever, Universal Healthcare Access Coalition Steering Committee member. Good evening to you, Prof, and thank you so much for your time this evening. So we sometimes hear, right, from those who are proponents of NHI advocating for it, saying that it's only a small grouping that appears to be against it. So how big is this coalition and who's part of it?
Well, it's virtually all health professionals in South Africa, and we've got hospital groups that are involved. The Board of Healthcare Funders is included in the grouping, so it's a widespread grouping that cuts across the health system. The South African Medical Association forms part of it as well, which includes public and private sector doctors. So it's a wide grouping. It's people who know the health system, public and private, in detail, and are immersed within it. So it is a very informed group, and is essentially is a group that has typically operated in quite a lot of silos, because there's lots of health professionals in the health system, and now the issue is actually to work together as a group.
And as you are looking to, work together, you've put together like a proposed framework that you say could work. What is that one area, for example, that this framework is looking to address?
So the important issue to consider first is that the problem with the National Health Insurance proposals, which began, essentially the discussion began in about 2007, has resulted in basically the termination of all health reform in South Africa. So nothing has actually happened to improve the performance of our public system or our private system since 2007. And the last reforms that ever took place were in about 2004. So the problem now is that because people are promising national health insurance, which has no possibility of implementation, it means that people are going to continue saying our reform is national health insurance, and then they will do no other reforms. So this coalition is really looking now at the health reforms that are needed to protect and deepen our universal coverage framework in South Africa. And that involves basically looking at deepening the performance and improving the performance of our public system and our private system. So there are specific recommendations that address the frameworks for both of those, such that they will actually improve the quality of their coverage and healthcare access. So the focus is on, so one of the core understandings is that we will never have a universal healthcare model which is based on a tax-financed arrangement alone. It's not technically possible in South Africa. We have to look at a co-financing framework. So we have to mix both the contributory system, the contributory system is our medical scheme system, with our provincial health system as the cornerstone of our overall universal health coverage model. But both suffer from imperfections. And the problem is that there is no attention to dealing with those imperfections. And essentially what we're doing is making it very clear what those imperfections are, and what the approaches are to address them, and to essentially be very, very clear about what needs to happen going forward.
And when you talk about, this particular issue of the co-financing, you then have others who are saying that, but you do need to level the playing field somewhat for everyone else. So if you're still talking about the issues of co-financing, for them it raises alarm bells. Then you have others who are saying that it's still not even as clear as day to say how will all of this be financed when you then go ahead with implementing the act. So when it comes to this argument of universal healthcare for you, when it comes to the implementation, the nub of it, how do you see it play out?
So in the framework we're putting forward, essentially the financing is largely in place as it exists now. You're not changing the overriding architecture. What you're doing is you're changing the quality of the financing system. So there's a regulatory change that is required in the private sector. The cornerstone, the key components of it were identified in the health market inquiry that concluded in 2019. Government basically did absolutely nothing with that report and that analysis. And essentially what's being demonstrated here is that there is a wide consensus, public and private, for that report to be taken forward to properly regulate the private sector so that costs can be addressed and that the quality of the delivery of healthcare services in the private sector can be improved. But in the public sector, we have got endemic, systemic corruption that is in place largely because we have political appointments into the system. And essentially what is being proposed is a model and a framework that separates out the roles of politicians from the roles of actually administering and managing and running the health system. And that framework we propose needs to be put in place relatively urgently to protect the integrity of the public system, because too much money is being stolen in the public sector, and that is the reason why it is failing. And unless we get that addressed, we are going to continue to see a deterioration in the quality of both the facilities and the performance of the public system going forward. These have to be addressed. So those are the two systemic reforms. Yeah. But the framework also includes a lot of other aspects that haven't been addressed. So we also deal with those particular areas. And it's also not a closed set of proposals. The whole idea is that this is a convening space in which now the health system is going to get together and make specific proposals on what needs to be done and make it very clear to government that these are the issues that need to be prioritized. We actually have to move forward.
Prof, I'm keen to hear your thoughts then on this one, because you've just taken us back in time, right? We're hearing right now that there will be a preliminary list of public health facilities earmarked for pilot project rollout. There have been pilot projects in the past. Have they worked?
No, not at all. I mean, it's the pilot projects had no coherent methodology behind them. There was no theory of change that was presented. And there were no results that actually relate to national health insurance that were assessed in those pilot projects. They ended up being some kind of general public health intervention framework or a set of interventions. No systematic outcomes came from that, and that is in their own reports that are produced. So essentially pilots, those were not genuine pilots of NHI. They were pilots of something, but not NHI. So going forward, I don't know what pilots are going to be considered. Most of them will be a deflection from actually looking at what's not working. So if we look now at the performance of a lot of our public facilities and hospitals, you have to say, well, why are they deteriorating? Why is there systemic, long-term irregular expenditure across the board in 8 of the 9 provinces? Why? What is causing that? Why are they never corrected year to year? And irregular expenditure is an indication, it's a proxy indicator of corruption, because it is essentially procurement that hasn't complied with Treasury regulations. And for that to happen systematically year after year means the money is, billions are being stolen from the state and the public health system.
We see now the Ministerial Advisory Committee, which is said to going to include government officials, cabinet ministers and private medical aid scheme representatives. Can this help? Are you also looking to possibly submit some of your proposals there?
Well, I have no idea what that particular Ministerial Advisory Committee will do, what it will achieve, what it can possibly execute. There have been Ministerial Advisory Committees after Ministerial Advisory Committee from 2009 to now. They've achieved nothing, they've done nothing. They talk shops, and usually they're filled up with yes men, yes people, people who basically are not going to rock the boat. So they're not very effective. They don't really come up with anything critical or decisive. And there is also no execution capability in government that can actually translate anything coming out of a general policy conversation and move it onto the ground. We actually do know a lot of the issues that need to change in the health system. They are known. That's why this report and this convening space is being created. It will create implementable and identify implementable reforms that government should prioritize. And if government doesn't prioritize it, then it must actually indicate why it's not. Why is it leaving in place the ability of MECs to appoint hospital CEOs and people into key positions around the procurement system? Why is it appointing poor leaders into the public health system? Why do the MECs do that? So that is a structural imperfection that needs to be eliminated and addressed. But there's no political will to address that particular issue because it cuts across too many people. Too many people lose out from that kind of, from eliminating the possibility of political involvement in service delivery.
And Prof, let's see then, how some of your proposals are then, as a committee, began to be dealt with. But thank you so much. I appreciate your time this evening. That was Professor Alex van den Heever, who is Universal Health Access Coalition Steering Committee member.